following portion of Bloom is sponsored by Tampa General Hospital.
January is National Thyroid Awareness Month, a great time to remind everyone that this small gland in your neck has a big impact on your health. Tampa Bay is home to world-class expertise at the Tampa General Parathyroid and Thyroid Institute. And joining me today is co-founder of the TGH Parathyroid and Thyroid Institute, Dr. Jose Lopez, one of the leading surgeons in the field. It is great to see you, Dr. Lopez.
Great to be here. Thank you.
So, Dr. Lopez, first of all, explain what the thyroid is and its function.
Correct. So the thyroid is a little organ that sits at the base of your neck, right here essentially, and it's usually the size of your thumbs if you put them together. And it controls your metabolism. It controls wake-up cycles, your temperature, your alertness, and it can go haywire. It can go up or it can go down. So some people suffer from hypothyroidism, which means you have less hormone production, and that leads to weight gain, feeling lousy, problems with feeling cold all the time. And then the opposite happens when it's hyperthyroid. So you're hot, you're jittery, you feel like your heart's racing. Some people even feel like you're having panic attacks.
So there might be people listening out there thinking, oh my gosh, these are the symptoms I'm feeling right now. If they suspect they might have a thyroid issue, what should they do next?
Simplest thing to do is get your hormone levels checked, specifically your thyroid hormones. That's what you want to ask for. Get a thyroid panel, and a thyroid panel will pretty much give you the answer most of the time.
Now, what about the parathyroid?
So the parathyroid is the neighbor. The parathyroid shares a zip code with the thyroid, but those are 4 little tiny glands that just control calcium. And the treatment for parathyroid disease is only surgical. While the treatment for thyroid problems could be medical, sometimes medications, etc., and then sometimes surgery, more due to nodules, cancers. So that's the main difference between them. So they share the zip code, but they don't even talk to each other.
But why is it so important, if you have to go to a surgical intervention, to go to an expert like yourself, somebody that really knows what they're doing?
Great question. So there's a lot of people that can definitely do parathyroid in the United States and in the world. The difference is, for the last 15 years, my partner, Dr. Politz, and myself have dedicated ourselves to just doing pretty much parathyroid and thyroid operations. So that has led us to accumulating a huge amount of operations. These operations are delicate. There's 4 parathyroid glands in your neck, like I said, and only 1 thyroid. The thyroid is easy to find, but the parathyroid glands can be as tiny as a grain of rice. I've taken little tumors as small as 3 millimeters from patients' necks, and if you don't go to the right person, you may not end up with the right outcome. Also, there's this parathyroid tumors, 20% or so of the people can have a second gland that is bad. So if you don't look at all 4 parathyroid glands in real time, you may not get fixed.
Now, is it true, Dr. Lopez, that there are many, many people, especially women, walking around out there with thyroid issues, and they don't even realize that that's the problem? Correct,
yeah, and one of the easy things to do is just go to your primary care doctor and say, I don't feel good, something is not right. And most primary care doctors and most doctors actually will get a thyroid hormone panel on you when you have those complaints. But like I said earlier, if you have any of those symptoms of being hyper or hypo, it's not that difficult to diagnose.
Well, we're really grateful that we have an expert like you right here in the Tampa Bay area. Thank you so much for joining us and sharing all of your knowledge with our viewers.
Thank you for having me.
All right. For more information on Tampa General Hospital's Parathyroid and Thyroid Institute, visit tgh.org/parathyroid. Bloom will be right back.
The preceding portion of Bloom was sponsored by Tampa General Hospital.